Mr. D is a 55-year-old man born January 5th, 1950, who was picking up a bag of cat litter after cleaning his litter box when he experienced pain. He had immediate pain to the low back, and within an hour, pain was radiating down the posterior aspect of the left leg to the foot. He came in for an evaluation 2 days ago and was unable to complete the full evaluation because of pain. He had no weakness on evaluation, but his left ankle deep tendon reflex was slightly diminished. Both flexion and extension movements produced pain. However, flexion produced greater pain. No clear centralization was achieved. He returned today with a 9 out of 10 pain. When he is placed on a bike to try warm up, he noticed that he didn't feel the seat very well. He is a little hesitant to ride and distressed because last night he had an episode of bowel incontinence. He feels this happened because he had been pushing so hard trying to urinate the last couple of days. He had just pushed too hard when he coughed. He feels that if the bike makes him cough, it may happen again. The bike does not change his pain, and he has no demonstrated weakness today. On further treatment, repeated movements did not improve his pain or symptoms. He does not centralize and continues to report numbness to his inner legs bilaterally and groin area. His left leg pain continues to radiate down the posterior thigh to the foot. Some important information to note is the patient is currently experiencing a pain that is 9 out of 10. They're also experiencing bowel incontinence. However, they have been able to urinate prior to that. Also, initially they felt lower back pain. However, the pain radiated to the posterior left leg and foot, and he is still experiencing that pain. Also, the patient isn't feeling any type of weakness. However, the pain is radiating. The patient is also has had continued numbness in their inner thighs bilaterally and in the groin area. The patient was unable to complete the initial evaluation 2 days ago because of how painful everything was. And also, the patient is also experiencing flexion and extension pain. However, they're experiencing more of a flexion pain is greater. So now I'll be doing the S-bar scenario where I'll be making an outbound call to the doctor. So I'm going to go ahead and do that role play now. Hello, my name is Destiny, and I'm the rehab nurse for Mr. D. I'm calling from a rehab unit. That is the introduction. Now we're going to get into the situation. Mr. D is in room number 113 and is currently experiencing a pain level of 9 of 10. He doesn't centralize even after repeated movements. He continues to report numbness to the inner legs bilaterally and private area. His left leg pain continues to radiate down to the posterior thigh to the foot. This all happened because he picked up a bag of cat litter after cleaning, and he started to experience lower back pain. And then within an hour later, he began radiating down. The pain began radiating down to the posterior left leg and foot. So that was the situation aspect. Now I'm going to be doing the background part for the doctor and explaining it to them. So this part, I'm going to let the doctor know the patient was admitted into the hospital for pain in the lower back and posterior left leg and foot on July 20th, 2020. As of July 20th, the pain is a level 9 out of 10. The patient came in 2 days ago on July 18, 2020 for evaluation. However, wasn't able to complete the evaluation because of pain. However, there wasn't any sign of weakness, but it was noted that the left ankle deep tendon was slightly diminished. Also, the flexion extension movement produced pain. However, flexion movements caused the patient more pain. Also, he returned today on July 20 with bowel incontinence and increased pain. However, no signs of weakness today. So that was the background portion. Now we're going to get into the assessment portion of the S-bar. I believe the patient is experiencing pain in numerous areas. They are experiencing numbness in posterior left leg and foot. Also, bowel incontinence. I believe the patient has a herniated disc. So I would let the doctor know that I believe the patient has a herniated disc, and I'm going to want to come in here to help the patient. So for recommendation, I would tell the doctor that the patient would need to be seen now because they're experiencing all the 4 telltale signs of a herniated disc, which is the incontinence, the numbness, the pain. So they would needs to come in and help the patient out. For the recommendation, I will let the doctor know that he or she needs to come in and see the patient now because these are all telltale signs a patient may have a herniated disc. And then I would document the information regarding the patient's condition and then the physician notification.
Oh, my back. Oh, this pain. Oh, I shoot down my leg. Oh, I can't feel it in my left leg. My foot. Oh, let me call the doctor. Yes, come in.
Hi, my name's Destin. I'm your nurse today. Why are you here today?
Lower back pain and my left pain in my leg and my foot.
What happened?
I was picking up cat litter box and I just felt this sharp pain and then it just resided down to my left lower leg and foot.
Awesome. I'm gonna have you do a little bit of exercises. Can you like flex your leg for me, please? Just kick it back and forth.
Okay.
Like that. Yep, and then do your neck. Okay. Do you feel any pain? Does it hurt at all?
Yeah, it still hurt.
Okay. On a scale of 9 to 10, like what are your pain levels?
9.
A 9? Well, I was gonna have you go warm up on the bike. Are you comfortable doing that today?
No, that seat was uncomfortable.
Seriously.
I'm urinating and I'm bowel moves. You know, I'm scared to get back on the bike because it might happen again. So that's what I'm experiencing.
Well, we'll go ahead and monitor. I'm gonna have to get on the bike, but we'll go ahead and monitor that. Okay?
Okay.
Thank you. I believe the clinical scenario did an amazing job in assessing the patient because I can tell they used the PQRST method in assessing pain, which is the gold standard and most accurate when measuring pain. The PQRST helps aid in the selection of appropriate medical intervention. Some things that I think they could have added, they should have taken the patient's blood pressure in order to determine if the blood pressure was elevated because when there's pain, the blood pressure will usually elevate if the patient is experiencing pain. They should have also did a gait monitoring exam in which the healthcare professional will observe whether the patient appears to be walking slowly due to pain or with an abnormal gait. They should have also checked the lumbar spine, the lumbar spine exam and checked to see if it showed inflammation or appeared sensitive to touch. Some things I think they should have left out. I believe they should have taken out the bike riding of the scenario because it really didn't make sense to have the patient ride the bike since they were in so much pain. They should have did another form of physical therapy for the patient, such as stretching or ice therapy. If I were to do the conversation over again, we would make the patient do an X-ray exam or MRI scan in order to determine if the patient has a lumbar herniated disc, instead of solely relying on the patient regarding their pain levels. We should have did our own pain assessment through vital signs and checking checking the X-ray or doing an MRI. I do think it was clearly presented to the physician because the PQRST was done, and we were able to get the severity of the pain, which is a 9 out of 10, and the patient is experiencing bowel incontinence and numbing. From that information alone, the doctor is able to determine how severe this scenario is.